Well, thank you all for coming in today. And I want to start this section talking about the signs and symptoms of bowel cancer. What is it that people should be looking out for?
Okay, so some of the symptoms that might occur are a change in bowel habit, so it's anything that's a change for you from your normal bowel habit, a lump in your tummy, pain in your tummy or abdomen, bleeding from the bottom or from your poo or in your poo, and unexplained tiredness, breathlessness, dizziness, unexplained weight loss. All of those symptoms could indicate bowel cancer. But what we would recommend, based on the evidence, is that it's safe to watch and wait for up to 3 weeks. And if symptoms persist, then you should definitely go and see your GP and get the GP to look into it. Now, in most circumstances, those symptoms will not be bowel cancer. They will be another condition, and we've talked about some of those conditions. They could be irritable bowel syndrome, piles, ulcerative colitis, simply constipation. But it's important to talk to your GP, and if you think that those symptoms are worrying and the GP agrees, then they should refer you for further tests.
And also I think whilst you're there, they can always do some blood tests.
Yes.
And one of the blood tests which is crucial for bowel cancer is, maybe just to give you an idea, but there is something called a tumor marker for CA199, or you could use a CEA, which surely something Vivian had to go through and check
all the time.
Each time she comes for treatment for 6 months, we'll check her tumor marker, and this could give you an indication of if there is something wrong with your bowel or not. I think it's important that people understand the signs and symptoms also of bowel cancer.
Absolutely.
That they may not be aware of. And for example, there is extreme tiredness. If you know for a few weeks you've been extremely tired, or loss of appetite without any reasons. You could also bleed from the bottom parts, or bleeding in the stool. And also any change in bowel habits lasting 3 weeks or more, or maybe a pain in your tummy, or maybe pain when you go to the toilets. So any changes, you should report to your GP as soon as possible. You should not wait and think it will get better. I think it's safer to get yourself checked.
My cancer wasn't actually that early, it was stage 3C, so I did have 6 months of chemotherapy afterwards. But basically what actually happened with me, I did have blood in my stools, I did have blood in my poo, back passage, but because it was very fresh, the doctor decided it was hemorrhoids. So actually what happened was I was on a 3-yearly colonoscopy check, because I had a polyp removed back in 2009. I went to the doctors in March 2012 with blood. It was diagnosed as hemorrhoids, so I just waited until it was actually my colonoscopy time in the October. Symptoms hadn't reduced, as it happens, and that's when the tumour was found all the way around in my colon. So just going on to what a colonoscopy is actually like. I've had a few, and I can't have any more now because I don't have any access, so that's great. I don't have a colon. So yeah, basically it is a camera up your bottom. I vaguely remember one time having just a little something in the back of my hand. It makes you a bit drowsy, and that was absolutely fine that time. Everyone's different. You can have gas and air, which is I think what I had the second time, and it was much more uncomfortable because it feels like it's blowing your tummy up basically. So you've got the camera going into your bottom and having a real good look around. But as I say, it's quite interesting because you can actually watch the camera on the screen, so you can actually see how lovely and clean your colon is, because you've had I certainly had some product stuff that I had to take to start off with to clear everything completely out. So that's an interesting sort of little effect in the first instance before you go off and have your colonoscopy. But as I say, the first couple of times when I had a colonoscopy, it wasn't a problem, and it was quite interesting just watching what was going on the screen and seeing what was going, where the camera was going. Yes, it was an interesting experience, to say the least, but that's how my cancer was found. So I'm very thankful that I was on a 3-yearly colonoscopy check, because otherwise that might not have been the case. It might not have been diagnosed and treated as soon as it was.
And the other, I think another important thing to say is actually to look in the toilet after you go to the loo, which we aren't very good at doing over here. And I know that on the continent, actually, toilets are designed in such a way that your stool actually stays in the toilet for a while, so you can have a quick look and make sure that everything is okay. There's a thing called the Bristol stool chart, which always causes a bit of a titter, but is actually quite a useful tool to help you to understand the consistency, what is normal for you and what might be a bit of a flag. And, as you said, Steph, always check when you go to the loo. That's one of the most important things you can do to look after yourself.
So it sounds like the real challenge is the fact that the symptoms, the indications, are also indications of many other things.
Yep. So
that makes the screening very important.
Mm-hmm.
So what kind of screening is available to us here in the UK?
There are publicly available screening programmes across the UK from age 60 in England, Wales and Northern Ireland, and from age 50 in Scotland. And that is the fecal occult blood test that Stephanie talked about earlier, which is you will get through the post a pack, and you will be asked to take 3 samples of your poo in your own home, put it in the post, send it back, and you will get a result of that screening. The other piece of information is that there's a new, much more effective test called FIT, which England has agreed to introduce from 2018, and Scotland will introduce at some point. So this is a new and better, more sensitive, more effective test that everyone recognises will be better, but isn't yet in place, but is coming.
So these are the things that people should ask their GPs about if they do have any concerns?
They should, yes.
And what kind of screening is available at BMI, Stephanie?
So at BMI we have blood tests, as we spoke about. We also have colonoscopy, and we do offer the FOB as well. So that's what we have in BMI.
So I'm thinking really of people who aren't in those, I guess, they're high-risk categories. That's why the screening comes in automatically at that point, the NHS screening. Is that correct?
Yeah.
Yes.
So, but if you do have concerns and you're not...
It's a universal screening program. So the screening programs are universal. You don't have to be identified as high risk. You have to be identified as over 60 in England, Wales and Northern Ireland, or over 50 in Scotland. So we would say, you know your body. If you are worried, then do be insistent, be assertive about getting a referral for further tests.
We would agree with that entirely. It's quite hard to say, put it on yourself and take responsibility for it yourself, but because bowel cancer is among a plethora of other conditions which are, affect hundreds of thousands of people, you are likely to get a diagnosis of IBS, which we don't know enough about either, before a diagnosis of something like an inflammatory bowel disease. So I'd agree entirely with Judith on that. You know your body, you sort of have a gut feeling if something is wrong. So go back and harass, and you will get a referral if you keep going back and asking for one.
I quite like that idea of having a gut feeling. That seems very apt, doesn't it?
Yeah, but it's true. There's a lot of the vagus nerve, which is in your gut, actually sends messages to your brain rather than the other way around. So although we term it a gut feeling, and it's sort of gone into common parlance, it's actually got a very solid scientific background, and actually gut feelings should be taken very seriously by everyone.
Trust your bum.
Yeah.
It's trying to
go for that job, don't go for that job, have a child, don't have it. Your gut will often be quite a good indicator of whether you should take that decision. So it's not just about going to the GP in that instance.
That's the end of this part of the discussion. If you want more information, look out for the other episodes in this series and visit our website at bmihealthcare.co.uk. Look out for the Be Bowel Cancer Aware campaign page where you can download our awareness guide.